Hi guys and welcome back to my channel. My name is Girija and I'm a final year MBBS student. I study in the Wenzhou Medical University in China. But right now I'm in India because number one, I'm still stuck because of the COVID situation, and number two, I've just completed my exams and I have a 2-month summer vacation. So I came up with the idea that now as I'm going to start my final year, I have so many questions about my post-graduation entrance exam already popping in my head. There must be so many students just like me thinking about what are they going to do about their post-graduation. And that's how I came up with the idea of TheDocPod. TheDocPod is a series on my channel where I will be hosting interviews with doctors who have completed their specialization in various different fields that medical profession has to offer. So why not to learn from the experts themselves about how to crack these examinations and what it feels to actually be a doctor of that particular specialization. Because isn't that what you dream about since day one of your MBBS? So let's begin this amazing journey of TheDocPod with various doctors, but beginning with vision. Now, what do I mean about vision? Well, vision is a word that is very important in not just physicality, but in your mentality as well. Your life took a huge turn when after your 10th grade, you decided that science is going to be my field of education of choice. When you learn for your undergrad exams, you crack those, you go to your medical school, start pursuing MBBS, it was all about a vision that a young kid had just dreamt of. It all begins with vision. And that is why vision is so important in our lives. And that's why you need an ophthalmologist. So why not to begin this amazing podcast with the value of vision, the organ that is eyes, which make you see this beautiful world. Today we are going to interview Dr. Sanket Deshmukh on our channel, who is a great ophthalmologist, and we are going to interview him in order to know all his success strategies, what students should really understand about this vast branch and what it has to provide for ourselves and for the society. So stay tuned and keep watching. Also, for any of the students who just want to know about the specifics of this interview, I will be mentioning all the chapters here on the seek below and in the description box as well. So you can just hop on to whichever part you want to watch so that you don't waste your time. Also, if you haven't subscribed yet, you should do that because it is completely free and it will add a value to both your and my life. So don't forget to click the subscribe button below and also the bell icon, and follow me on Instagram as well. But now let's stop talking about me and understand what Dr. Sanket Deshmukh has to talk to us. Also, one important thing, you can watch this video as a podcast by just listening to it. So just grab your earphones or some snacks if you want to and listen to this enriching podcast that is going to add so much of value to your knowledge. So just wherever you're going or whatever task you're doing, just plug in your earphones and listen to our conversations. So finally, I am so glad to announce that Dr. Sanket Deshmukh is the first ever guest on my series called TheDocPod. Dr. Sanket, welcome to my channel, and I'm so happy and excited to have this conversation with you today. And first of all, thank you for saying yes to agreeing to shoot this podcast with me. We're just waiting for you to answer all the questions that we have in the box. And how are you feeling today?
I'm really feeling very great actually. This is a very good topic you have selected for the podcast. Why? Because as a student, when I was about to appear for my PG entrance, I had the similar set of questions. What is that I would be doing for the rest of my life?
Exactly.
And I got my answer, and I think I'm really very lucky, or I would say that best things have happened for me after I have selected ophthalmology.
That's great, and that is exactly what we need to know from you, that how was your journey overall. And let's begin with a set of questions. So the first question that I have in my mind for you is, what is ophthalmology according to you, and what does it involve?
Ophthalmology as such is a science of eye, as we all know. It involves taking care of vision and sight. So it might not be wrong to say that it is the most important sense of human being. I did my ophthalmology, I have come across to many blind people, and I know how the giving vision is so impactful to that person. It completely changes the quality of life of that person. So I would say that ophthalmology is a reward of giving or gifting vision and sight to the needy people.
It's amazing that someone just defined ophthalmology is in the most amazing manner possible. And sir, how does it actually feel to be an ophthalmologist? And when you deal with patients, when you just look at cases every single day, do you feel that this was the perfect field made for you, or you had other plans?
As I sit on the chair of ophthalmologist every day, I feel really very fulfilling, and I think I was meant to become an ophthalmologist at the end of the day. But that was not the case when I was trying to crack my pre-J entrance. Those are the times you are always in a dilemma, what should I do?
Exactly.
But somehow there was a gut feeling that I wanted to become a surgeon. I came to know during my internship tenure that I can acquire skills, or I have that ability to acquire those motor skills to become a good surgeon. Slowly I was inclined towards it. During the PG entrance, when I was reading about surgery as such, I was really fascinated with the different procedures, and also somehow the destiny guided me towards ophthalmology. I got into DNB program in Ganpati Netralaya Jalna.
Which is very prestigious in Maharashtra.
Yes, and good training
institute.
Yes.
So when you completed your DNB in ophthalmology, you just wanted your field to have surgery as a part of it. Like, you were not specific about it, you just wanted surgery. Is that the case?
Yes. Because somehow I knew that this is what I can do, what I am able to do. And on the other hand, I might say that the medicine field did not
attract you that much.
Me too much. Yeah.
That is amazing, but I personally feel that you manifest your interests. Whenever you think about something passionately, life just guides you towards it automatically, and that is what happened with you.
Right, might be.
Sir, when it comes to being an ophthalmologist, what is your lifestyle like? Like, how does your day start? What do you do in your day? Like, how does a day in the life of an ophthalmologist look like?
I'm an early morning person. So I wake up early in the morning, 6 o'clock usually. The OT starts at around 8:30. So it is always best to clear the operative procedures early in the morning. There are different types of cases. Majority of chunk includes cataract surgeries, but usually there are retina surgeries which are done by the retina specialist. Then trabeculectomies for glaucoma and other pediatric surgeries also there, which, and those are operated under general anesthesia. For each and every surgery there are different kind of specialists. After the OT is finished around 10 or 11, I go to the OPD, and there are different kind of cases that we see. It's really interesting, and to solve those puzzles, what exactly by doing different investigations. Our branch is very machine based, so there are many investigations that we can do to precisely find out what the patient is suffering from. The day goes like this till 6 o'clock, and after 6 p.m. I am free to do whatever I want to do.
That is so cool. Like, whenever we think of doctors, we always think of a hectic lifestyle subconsciously. But this is a branch where you get to do your surgeries, where you get to do whatever you want, but within a specific time limit. And that is so cool. Also, how does it feel when you actually give vision to someone? Like, was there any heart-touching case that you dealt with when you realized you were meant to be in this field?
Yes, I was lucky enough to get that experience early in my training itself.
Yeah.
In last few months of my training, we were fully trained with cataract surgeries.
Okay.
And our center has rural sub-centers. We used to get posted there, and as a only operating surgeon, I was supposed to take care of all the surgeries there.
Yeah.
There was an old lady who came to the OPD once, was helped by her sons to walk because she could not see.
Okay.
When I examined, she had total cataract in both the eyes.
Okay.
For us, it's a most common avoidable cause of blindness. If she had gotten a good cataract surgery earlier, she might not have landed up in this situation.
Okay.
The next day we posted for her for the surgery, and the surgery was over. In the evening time, we usually remove the patch, and at the end of the day, when we removed the patch and she could see clearly, she was so happy. I can still remember those
moments of your life.
Yes, and her smiling face. She thanked me, and I also thanked God. I think that was the time I realized this is what I am supposed to do.
Yeah.
And there is a great joy to gift vision.
This is the most heart-touching story which comes right from an ophthalmologist, you guys. This is what gifting vision looks like. And so when we talk about ophthalmology, it is a vast branch, but many of us don't know what actually are the sub-branches involved or sub-specialities involved, which has scope for young medical students who are approaching this field. So how would you guide them based on the sub-specialities?
There are different subspecialties starting from the anterior part of the eye as you move posterior towards the optic nerve.
Okay.
Each and every layer can give rise to a different subspecialty. So cornea, uvea, cataract and refractive surgery, it is itself a emerging subspecialty. After that, the majority after the retina, then the optic nerve, you can become a glaucoma specialist as well as a neuro-ophthalmologist if you are interested in treating the diseases of the optic nerve. Pediatric ophthalmology, where you treat diseases of the eye specifically seen in children. Also, ocular oncology is an emerging branch. I won't say it's emerging, it's already established. Which includes tumors of the eye. Oculoplasty surgeon, they take care of the eyelid and areas outside the eyeball. And ocular aesthetics is, I would say, is a newer emerging branch, and everyone is talking about it.
I never knew these many branches existed, and I'm so grateful for this podcast for just enriching our knowledge with such great fields of ophthalmology. Like, I never knew about this, so thank you so much for guiding us on that. Now moving on, whenever we think about any other field, we know that there are so many misconceptions about the same. For example, when people think about doctors, they just naturally think, oh my god, they'll be earning a large amount of money, or you know what, this doctor just doesn't get time to spend with their family or something, which is sometimes true, sometimes not. So when it comes to the field of ophthalmology, to be precise, what are the misconceptions that people have about you as being an ophthalmologist?
Most common misconception that I come across is people think that ophthalmology is about dispensing glasses. It's not true. It's not only about that. There are so many aspects to the science of ophthalmology. As we have already discussed, there are so many subspecialties, and each and every subspecialty is ever evolving. There's a lot of there are so many diseases that need research and need newer treatment modalities. And obviously the technology is helping with that.
So like the biggest misconception that you have to deal with is that you are a doctor who just dispenses glasses, but you're not. You have like so many surgical aspects to it and so many other things involved. So that is like a precise answer, I feel. So when it comes to ophthalmology and the branch as a whole, what qualities do you think an MBBS student must definitely have in order to pursue this branch as a career in future? And what challenges do you have to face in general when you enter this branch whole and soul?
Anyone can become good ophthalmologist. As such, there are not very special skills that you should have. You can acquire those as you go through your training. But some things like visual or photographic memory is important to have, as many of the diseases are easily diagnosed if you have a clear previous picture in your mind about that disease. Also, acquiring motor skills because we are dealing with the microsurgery. Whatever we do is through a microscope. So it requires a good hand-eye coordination. That is the one thing that you will have to learn during your training, but it's not very difficult to acquire. This skill is acquirable.
Up till now, we have discussed what ophthalmology is, what actually goes into being an ophthalmologist, what is the lifestyle like. Also, one question that I missed out was, what is the actual difference between lifestyle of an ophthalmologist versus lifestyle of the people who work in other specializations?
Actually, I would say the timings, the amount of time that we give is really very limited, or I can say selective. You can select your working hours. You are free to do that. Even though there are emergencies, I won't refuse that there are no emergencies, but those are very minimal. And you are free to do your own things in that free time. You know that after 6 o'clock my mind is free and I can give that dedicated time towards family. That is the biggest difference. And also as such, it's not a physically demanding branch if I contrast it with orthopedics.
So this is also a better field of choice, I would say, to maintain a better work-life balance. Because you get enough time for your family, but you also get to like work where you're truly interested. So that is amazing. And so now, I am a final year MBBS student. I'll just be approaching my final years in 2 months. And if I have to prepare for my PG entrance examinations, or if I have to prepare for my university examinations, what would you suggest? Like, what is your study pattern? What did you do to crack your examinations?
The most important thing is to remain focused throughout a period of at least 12 months. So I used to study for at least 14 hours a day, and that is what is required to crack this entrance. Having a good friend circle, because it is very important to get motivated. So if you have your buddies to help you out, or to take you up through your phase where you are depressed or think that you don't want to study for so long, what am I doing? Those are the questions that come to your mind when you are actually doing this repeatedly same thing for 12 months. But that is what is required: a good friend circle, family support, obviously, and a good trainer or teachers. Yes.
So that is amazing that you could study like 14 hours per day, and I definitely take inspiration from that, and I hope you guys do as well. And when it comes to studying, sir, these days people don't read textbooks as much as you guys used to, because like the situation because of COVID changed everything in the educational sector. Like we have apps, we have everything, but in this world of apps and lectures, what books do you recommend for studying ophthalmology on a undergrad level and on a postgraduate level?
Yes, first of all, I think it is a good change that we had to refer only books, refer to only books, but now you have different apps. I have come to know about these newer apps where you have a selected or concentrated study material and lectures available just at your fingertips. You're free to do at any time. But if you want to go ahead with only books, like old times, Parsons is the best book during your undergrad time, and that can give you good knowledge about ophthalmology, which is also important to crack your entrance as ophthalmology as a subject. During your post-graduation, Kanski and Yanoff, these are the two standard books from which each and every ophthalmologist they from India, they will refer to these two books. Kanski.
So I will provide the links to these textbooks in the description box below, and you can just buy them off from Amazon or various websites. You can just check the description box, or I'll also mention the details mentioned in this podcast through my Instagram stories. And you should definitely follow me on Instagram. So, do you have an Instagram account?
Yes.
Then you should definitely follow me once we complete this once we're done with this podcast basically. And so, did you subscribe to my channel, by the way?
Yes. I have seen all of your videos actually.
That is great. You should take note that an ophthalmologist watches my videos, and I feel so proud to say that.
Yes.
I am so happy that I just successfully completed this podcast with you. So it was amazing talking to you, knowing about all the aspects of the science of vision, and I feel so great. By the way, sir, while ending this video, would you please ask my viewers to subscribe to my channel if they haven't already?
Yes, she is really very awesome, and do subscribe her to get such a vast of knowledge which is waiting for you, and don't forget to get your tea of positivity.
Wow, he does know my tagline, by the way. So if
I stole it today from her.
Yeah. So if you already haven't, please subscribe to my channel. Keep watching these videos, and I will update you guys with the upcoming videos on my Instagram as well. So don't forget to have your cup of positivity, and thank you so much for watching this video.